Sorry. It's just part of the uniform these days. Hi, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Here to give you our December 11th update on the impact of the COVID-19 pandemic on Mobile County. Globally, we are approaching 70 million cases of COVID-19 with far greater than 1.5 million deaths from COVID. In the U.S., just over 15 million cases with over 290,000 deaths. And in Alabama today, reporting 775 cases with 4,086 deaths. So we have gone above the number 4,000 deaths from COVID-19 in the state of Alabama. In our daily report today, in collaboration with SSI, thanks SSI, Mobile County has seen 22,053 cases of COVID-19. To give you an idea about how cases have been going up and up, yesterday 244 cases were added. On Wednesday, 218. On Tuesday, 213. So again, we are seeing quite a rise in the number of COVID cases that are reported to us on any given day. Just to put it in perspective, everyone's asking, are we seeing the result of gatherings over Thanksgiving holiday? And the answer is definitely yes. And now we're seeing, a secondary transmission that is occurring from people who were infected during Thanksgiving and now are spreading into other places. So like for the 2 weeks before the week of Thanksgiving, in Mobile County, we had around 1,500 cases. And in the nearly 2 weeks since the week of Thanksgiving, we've seen 2,500 cases in the week. So an increase of 1,000 cases per week, the result of Thanksgiving holiday and the gatherings and things going on at schools and outbreaks in nursing homes. And it's a pretty dire situation out there with regard to transmission. So 390 have died with COVID-19. Yesterday we added one. The cumulative number of people hospitalized is 2,798. 15 additional COVID patients were hospitalized yesterday. And the number of people hospitalized in Mobile with COVID-19 yesterday was at 115. So we saw sort of a leveling of the number of patients hospitalized each day with COVID, which is really good news. So continue to work really hard to protect people from, that might experience complications requiring hospitalization. So, we know about 50% of the new cases are caused by people who don't even know they're infectious. So, they don't know that they're spreading COVID, and that results in about half of our cases. So please do everything that you can do to protect people who are older and who have underlying medical conditions. One of the things where we see transmission really occurring, of course, is in households. So when you have a parent or a child that gets sick with COVID, it's not unusual for the entire family to be infected. If it's a dense household where you have a lot of people in a small space, or you have small children that you can't distance from because they need care. So we do know that we see a lot of transmission within the household, and there's not much that we can do about that in most cases. But a lot of transmission is also occurring among families. So families that live in different households gathering and thinking really nothing of it because, hey, we're all in the same family. But those situations where you have family members, but people who don't live with you, so, brothers and sisters, parents, grandparents, families, cousins and their families, getting together is an especially risky situation for high transmission of COVID in those settings. So let's see, I often report on the number of complaints that we've gotten this week. We've had 10 COVID-19 complaints on permitted establishments. We get many more on establishments that aren't permitted, but we've had complaints on 5 restaurants, 3 retail establishments, 1 school, and 1 daycare. So we continue to do consultations with these locations and help them understand the current Safer at Home order and the current guidelines, public health measures for slowing the spread of COVID. So you probably have already heard this week that the governor extended the Safer at Home order through January 22nd with no changes. So there is still a mask mandate. There is still a limitation on gatherings. Gatherings are not permitted. Just to sort of remind you what a gathering is, it's an in-person church service, whether it's inside or outside, is a gathering. Weddings and funerals are gatherings. Conventions, parades, lighting events, those things are all gatherings. So just make sure that you understand that gatherings are prohibited, that cannot guarantee or ensure that 6-foot distance among people who don't live together. Indoor gatherings are a really bad idea. If you must have a gathering, have it outside to the greatest extent possible. Limit the number of people there and shorten the duration of the gathering to try to reduce the risk of transmission in those situations, in those gatherings. Also this week, the state health department commented on their decision on whether or not to adopt some new options for discontinuing quarantine that were put out by the Centers for Disease Control earlier this week. So let me just try to be very clear about this. People who are COVID positive, there has been no change in the duration of isolation. It's 10 days, period. No testing out of isolation. Anyone who tests positive for COVID should not get tested again for at least 90 days. If you test positive for COVID, you should remain at your home in isolation for 10 days and only lift isolation if you are no longer symptomatic on the last day. For people who are exposed to COVID, right, they've been around someone who's COVID positive, quarantine, staying at home, at your house, not going anywhere, is 14 days. That's the best practice. CDC is still saying that 14 days of quarantine still gives you the highest probability of not transmitting COVID to other people. After 14 days, the risk of you transmitting COVID to other people are so minimal. Just go ahead and go back to work after 14 days. Go back to school after 14 days. They came out and said that there are 2 additional options for shortening quarantine that were made available, recognizing that there is risk associated with those 2 things. So the state health department, because of the high transmission and the limited availability of COVID testing in some rural areas, the state health department has elected to allow adoption of the 10-day asymptomatic option for discontinuation of quarantine for people who've been exposed to COVID. So if you have been around someone who had COVID, the best practice is to stay at home for 14 days. You have the option, schools have the option, businesses have the option of discontinuing quarantine at 10 days if you have monitored yourself for symptoms and continue monitoring through 14 days, and that you're asymptomatic. So again, the health department will continue to recommend 10 days, but we acknowledge that you have the option of discontinuing at 10 days if you are asymptomatic, have done daily self-monitoring of symptoms, and continue that daily self-monitoring of symptoms through day 14. The reasons behind this that CDC has given is that they're trying to balance risk with compliance. So a lot of people have just sort of laughed off 14 days of quarantine. We realize it can sometimes lead to economic burden, a burden on family members, those sorts of things. It's not easy for people to stay at home for 14 days. So what they're trying to say is that we'll try to give you an option for only 10 days, but we're going to expect everyone to comply. We expect there will be more compliance because there's a 10-day option now in addition to the 14-day recommendation. So again, if you've become exposed to exposed to COVID and told to quarantine for 14 days, you are the one that can protect yourself. So if you protect yourself and don't get exposed to COVID, then you don't have to worry about whether or not you can quarantine for the full 14 or for 10 days. You'll be fine and not have to quarantine. So please, because of you protecting yourself, you can avoid it altogether. But we will not be offering anything other than the 14-day and the 10-day options for discontinuation of quarantine. Okay, 2 questions and then one or two other things. So there was a question from the media asking about COVID-19 hospitalizations statewide that are running about a third above the July-August peak. But in Mobile, we're seeing less than what we saw in mid-July, and someone just kind of asking my thoughts onto why that might be. I'd like to think that it's, community coming together to protect people who are most vulnerable. So hopefully you all are out there because of you, that we're seeing, not seeing the number of hospitalizations that we saw back in July. So please keep up the good work of protecting those people. Also, we're doing a much better job with testing. These days, we have a lot more testing capacity out there. So hopefully people can get tested early, and if they are COVID positive, can really take control of their health and really try to, stay healthy and avoid hospitalizations. We are seeing a much lower number of COVID positives in our long-term care facilities. That's another reason that we may not be seeing as high a burden on hospitals right now as other areas of the state are seeing. But we can't be complacent. So again, it's because of you that, we can protect. It's only because of you that we're able to slow spread and protect those community members that might require hospitalization if they were to become infected with COVID. All right. Someone else, I think these are my pals that just relocated to Mobile from Texas, asking about a family funeral. They've opened the service to the entire church family. So here's the thing. With funerals, it is best to have only the immediate family members present in an indoor space. So if it's someone who, has a lot of people want to pay their respects, or if the visitation is going to be, potentially quite large, then try to, have a controlled entry and exit into the visitation area, increase the ventilation in the visitation area, maintain 6 feet of distance, right? So you can line people up on the sidewalk or ask them to stay in their cars until they are invited to come into visitation. There are things that you can do to try to have a safer viewing or funeral services for a family member. But it takes some planning, and it takes, the family really making their expectations known. And then it's best to have someone sort of keeping an eye on things, maybe someone who's not in your family, maybe an employee of the church or the funeral home, to really try to remind people that they need to space and wear a mask and disinfect their hands throughout that time. And again, don't allow people to linger, right? Let them come, pay their respects, exit through a different door, and then return to their cars. Okay, I'm wearing my Get Tested t-shirt again today. Can you see it on Facebook, Mark? Okay, Mark's giving me a thumbs up. So again, Monday through Friday, anyone who wants a COVID test can get tested at the Mobile County Health Department, any of our 8 sites, by calling for appointment at 251-690-8889. I've heard this week that the wait times waiting to get through the phone have been longer. So we are looking at adding people to our phone lines, and potentially over the next week or two, maybe even opening up walk-in testing at our Keeler location again, but more to come on that. However, we are out in the community doing testing. Tomorrow we have an event in collaboration with Yorktown Missionary Baptist Church. They have a monthly food drive. We will be there providing free rapid COVID testing and free rapid HIV testing. And then next Saturday, so December 19th, We're having another Know Before You Go event. Some of our staff are calling it affectionately a Know Before You Go Ho Ho, or a Know Before You Ho Ho Ho. So the Saturday before Christmas, at 3 locations, our Keeler locations, our Sims locations, and our 8 Mile location, from, let me make sure I get this right, from 10 to 2, so from 10 o'clock to 2 p.m. at those 3 locations, we will be offering drive-through rapid COVID tests. Now, the test takes 15 minutes. Getting through the line to get to that 15-minute test, you can probably expect a little bit of a wait. The last time we did this in advance, the Saturday before Thanksgiving, we had people lining up hours in advance. We learned a lot of lessons, which is why we're only doing it this time at the 3 locations that really can facilitate the traffic flow. We have many more staff on hand to help with testing and investigations for the positives, traffic flow, paperwork, all of that. So we think we're going to be able to have the biggest impact at Keeler, at 8 Mile, which is on St. Stephen's Road in Pritchard, and at our Sims Health Center, which is on 3810 Wolf Road East. We're going to be prepared to test at least 500 at each of those locations, but in addition to wearing your mask and bringing your hand sanitizer and bringing your own pen and a hard surface to write on, you might think about, bringing a book on tape, or maybe some games for the kids, something, maybe a couple of magazines to do some online Christmas shopping. So please be patient with us. We're excited to be able to do this again on December 19th from 10 to 2. So that is really all I have today. Oh, sorry. I will mask up. And Dr. Scott Chavers, our vaccine subject matter expert, is going to come in and talk to you a little bit about what we can expect with the COVID vaccine over the next couple of weeks. What he says goes. Anything that I say is probably not even close to the truth. And then he'll take any additional questions that might have come up on Facebook while we've been talking. So hold on just a sec for Dr. Chavers.
Hey, is it still on? Okay. Well, the screen's frozen. Yeah, there's nothing happening. Look on your phone. I'm hearing you. Were you okay? Okay.
All right. Hi, everyone. I'm Scott Chavers, epidemiologist and head of COVID response here at Mobile County Health Department. What I wanted to do today is give you an update on where we are with the COVID-19 vaccines and talk a little bit about what the distribution looks like and next steps in terms of the regulatory process, as well as talk about a couple of things that came up in yesterday's Pfizer Advisory Committee meeting. And then finally, I want to touch on just a couple of things with respect to vaccine safety that I have heard circulating out in the social media realm. So as many of you know, Pfizer went for an advisory committee meeting, which is an independent panel that reviewed Pfizer's data and essentially made recommendations with respect to whether the vaccine's benefits outweigh the risk. Now, if you've heard that the advisory committee meeting basically said and voted that the benefits do outweigh the risk for Pfizer's vaccine. So that is one more regulatory hurdle that has been cleared in terms of vaccine availability. The next step in the process will be the FDA will meet, review the data, and review the advisory committee meeting discussions, and then make their recommendations in terms of the emergency use authorization for the Pfizer vaccine. There were a few interesting things that came up during the advisory committee meeting. The first centered on whether the vaccine should be utilized in women who are pregnant or breastfeeding. So this is an important question because if we look at just the first round, the phase 1A vaccination plan, it's estimated that about 330,000 females will be either pregnant or breastfeeding during that time period. and FDA has yet to make recommendations in terms of whether the vaccine should be used in pregnancy and breastfeeding. The second interesting topic was whether the vaccine should be used in the age group of 16 and 17-year-olds. The reason why this was part of the discussion is that there wasn't sufficient data in that age group. So that'll be something for us to watch in terms of the indication for the emergency use authorization and what the lowest age group that FDA basically approves to be vaccinated. The next thing that was interesting, there was quite a bit of discussion around the safety of the Pfizer vaccine. And the discussion focused primarily on the events that were seen in the UK, where there was some very strong immune reactions in terms of healthcare providers when they were vaccinated. And these were severe. They resulted in hospitalizations due to anaphylactic responses, which are body-wide systemic responses. So it does appear that there may be an issue with the Pfizer vaccine in those that have hyperimmune responses, and that can include individuals with asthma or other underlying conditions. So that will be another question for FDA to consider as they look at the approval and the indication under the emergency use authorization. The next vaccine that will come before the advisory committee will be the Moderna vaccine. They'll go through the same process on the 17th of next week. Now, their data are likely to look different than Pfizer with respect to their clinical trial. So I don't know if FDA will wait until after that advisory committee meeting to see how both vaccines can be used in parallel, or if they will go ahead and issue their decision in terms of the approval for use. So it'll be interesting to see what happens over the next 2 days. I do want to talk a little bit about vaccine distribution. As many of you have heard, vaccine availability is likely to be an issue. The question around how many doses will be delivered to what state is still a bit in flux, and this is not an easy distribution framework with respect to the Pfizer vaccine because of its ultra-low temperature requirements. It does get a little easier with the Moderna vaccine because the temperature tolerances are not as strict, but the current strategy, at least within Alabama, is to distribute the Pfizer vaccine to those 15 hospitals that have ultra-low temperature storage, and then bring in the Moderna vaccine to cover the other areas that are not within the coverage area of those 15 hospitals. Now, I want to address a little bit about some of the concerns around the safety of these two vaccines. So there's been a lot of talk with respect to how quickly these vaccines were developed, because people think that they have been developed beginning sometime at the beginning of 2020, and now they're being approved in December of 2020. Let me be very clear that the technology behind both the Pfizer and the Moderna vaccines actually started in the early 1990s. So the messenger RNA technology has been around for years and in fact decades. When the SARS-CoV-2 virus was identified in China, China sent strains of that virus to Pasteur Institute and to our laboratories here to decipher the genetic sequence. And it became fairly easy then for the scientists to insert that RNA fragment into the messenger RNA delivery system, which is basically a protein that goes into your cells. What also needs to be considered here is the speed has been increased because many of the regulatory hurdles have been taken away. Let me be clear that these are not safety and evaluation hurdles, but these are bureaucratic hurdles. So a pharmaceutical company, when they submit an application to go to the next stage, often has to wait 8 months and up to a year for that process to be completed. What the federal government essentially did is they put those applications to the front of the line and very quickly reviewed these. So the time was compressed along bureaucratic nodes as opposed to the clinical trials, which were evaluating efficacy and the safety of the vaccines. And then finally, I want to just address some of the conspiracy theories that are going around. So we are in a very interesting position in that by the time that the vaccine gets to the general public, it will have been used in the UK, in Canada, and the US in our healthcare providers and in our long-term care facilities. So in addition to the individuals that are being followed in the clinical trial, we also have a wealth of information that will be available by the spring when the vaccines are available for wider use. So the safety in terms of long-term and with respect to what the durability is for the immune response will be better characterized. I can let you know that most vaccine reactions, if they're going to occur fairly quickly. There are very few vaccines that have deleterious events or vaccine-associated events that occur months and years out. So I think we'll have a much better evaluation of the safety profile for both the messenger RNA vaccines once it becomes available to the general public. I do caution you, though, if you're getting your science from Facebook, and we do love Facebook, to be cautious. If you're not hearing some of these conspiracy theories on the wider news, remember that the news agencies are actually monetarily incentivized to find these studies. So I encourage you that if you're not hearing this widely or outside of these pseudo experts who don't really have the background to look at these types of scientific studies, or if they're cherry picking one bit of science and basically dismissing the rest of the data around an event, you need to be cautious. So keep those three things in mind: pseudoscientists, cherry picking of the data, and these conspiracy theories where I'm the only one that knows this information. Those should be very, very good triggers for you when you see something to help you kind of do some critical thinking around whether I should believe this or not in a Facebook echo chamber. So that's all I had. Mark, are there any questions? No. Okay, very good. Thank you very much. We'll be back Monday with our expanded report. We hope you all have a good weekend. Happy Hanukkah to our Jewish friends that are celebrating that. We do want to remind everyone that as you are getting together for the holiday celebrations, to please wear your mask and continue to social distance. As Randy said, we did see quite a big spike after the Thanksgiving holidays, and we want everyone to continue to do their best with respect to mitigating transmission. So thank you very much. Have a good weekend.